Hi, so this is my neurological assessment. Before I begin, I'm ensuring that the scene is safe and there are no hazards and that I'm wearing all appropriate PPE. I would also explain what I'm going to do to the patient and get their consent while making sure they're sitting in an upright, comfortable position. So because this patient is awake and has been talking to me, I'll be giving them an A for alert on the AVPU scale. And while I'm doing this, I'm also going to do a quick fast exam, and because there's no facial drooping or arm weakness or any slurring of the speech, I'm not concerned about stroke. I will also consider the AEIOU tips, which is alcohol or acidosis, epilepsy, infection, overdose, uremia, which is kidney failure, trauma, toxin, tumour, insulin, psychosis, poison, or seizure or stroke, as these can all have an effect on a patient's neurological condition. I will also be prioritising BGL in the vital taking, as blood sugar levels can also have an effect on a patient's neurological condition. So moving on to the Glasgow Coma Scale, first I'm going to assess the eyes, and because they're opening spontaneously, I will give them a score of 4. If the response was to voice, it would be a 3, to pain is a 2, and if they weren't opening, it would be a 0. 0. So next is the verbal response. Because I've been talking to this patient and they're orientated, I can give them a 5. Yeah. If they're confused, it would be a 4. If it was inappropriate, a 3. Incoherent is 2, and if there was no verbal response, is a 1. And then checking the motor response, and because they can obey any directions I ask of them, they can have 6 points. If it's localized, 5. If withdrawing, it would be 4 points. Flexion is 3, extension is 2, and no response is 1. So this patient's GCS is 15, which is ideal. And next, I'm going to check the pupil response. The pupils are appropriately sized at 4 millimeters, and they have a fast response. It's not sluggish at all, which is good. And they can easily track all movements I'm making, so that's good as well. I haven't found anything neurologically wrong with this patient, so I will explain that to them and their family that they might have around. And but depending on their other injuries or symptoms, I would make my transport decision. Thank you.